My biggest thing when I'm talking to patients is, what can you control? When you get diagnosed, you feel so out of control.
Hi, this is Patrick.
And this is Laura.
And you're listening to This is Cancer.
Brought to you by Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis. National leaders in cancer.
This is an episode that I've been wanting to do since we started the show, and I'm really excited that we did it. On this episode, we got to sit down with 3 nurses from Siteman, all with different levels of experience, all with different motivations and backgrounds. I loved each one of them.
Me too.
I could have talked to them all day.
They're like the most empathetic people talking about, oncology nursing in a way is that they're getting inspired and feeling hopeful. And one of them, Julie, said she thinks she has the best job in the world. Not something you would initially think about when it comes to cancer care.
Yeah, you wouldn't expect an oncology nurse to come home every day and go, dang it, I love this job. This is the best job ever. Because it's not an easy job, but it takes a special person to do it.
And they love their patients. I can't wait for you all to hear them talk about, patients from 30 years ago, what they love about their job. And I think that if you are a new patient going through this, you're going to learn some things about how to navigate this process. And if you're loving someone through it, I think you're going to learn some things too. Okay, so we have 3 ladies here today, and I'm just going to ask them to introduce themselves real quickly and tell me what they do at Siteman Cancer Center.
Hi, I'm Julie Risk. I'm one of the treatment room nurses there. I've been there for about 11 years. I'm through WashU, but I work at the Siteman South County Center.
My name's Shannon Cruz. I'm a nurse administrator. I've been with Siteman for 19 years, started as a floor nurse, moved to an oncology nurse coordinator working with physician teams. And for the past 11 years, I've been in administration managing nurses and our teams.
Hi, I'm Pam Dowling, and I've been with Siteman 23 years. I manage the Patient Care Coordination Center, so essentially intake and call center for patients seeking care within Siteman Cancer Center.
There is one thing that I'm absolutely certain of, and that it takes a special breed of a person to be a nurse, because the things that you do, besides just tangible care for a patient, is just a part of your job. It's a social worker, it's a counselor, it's a friend, it's a psychiatrist, it's a therapist, it's all these things. And so I am always so interested to find out what made you want to become a nurse. So if you guys would each share that with us of what inspired you to take on this amazing role in life.
So when I was going into my senior year of college, I had been dating someone for 4 years, and he was diagnosed with non-Hodgkin's lymphoma. They thought it was pneumonia and just treated it with antibiotics and then did a CT scan at the end of the course of antibiotics, and that turned out to be a football-sized tumor in his chest. That became this cancer that we fought for the next 11 months. And he did great. He had treatment in the fall at a local cancer center. It was before Siteman really became Siteman. This was back in 2001, so 22 years ago. And he got the normal chemo that was out. There was no clinical trials at this local oncology center, but he got standard of care chemotherapy, and we thought he was done. They put him in radiation to make sure that they got the rest of the tumor. He got that for 6 weeks and then went into what they called remission, but it was really short-lived. Back in March, he started itching all over his body, and it was a very strange symptom. And they did a scan again and found nodules in his lungs, and those continued to multiply like 30% in every month. They just kept growing, and they figured out that it was recurrent lymphoma. And that's when we went to Siteman and met with some specialists, and they were trying to prep him for a stem cell transplant. And he was admitted, I think it was June 13th. His last admission was about 3 weeks long before he passed away in July of 2001. And they couldn't get him to transplant. He just couldn't. They gave him the hardest chemo, and It didn't knock it out, and he didn't make it. And he was 24 years old, and, we had planned our lives together, and that was totally rerouted.
Yeah.
And I thought life was over, But when I came out of that, we were both, again, graduating college. We were supposed to start our careers. Mine got delayed a few months because I just didn't know what I could do. I was going to be a computer programmer, and I did do that. I went to Boeing in October of 2001, the year he died, and I sat at a desk. It was kind of like Office Space. There were a lot of older people there that I worked with, and
Somebody asked you for their stapler.
pretty much. A lady that I'll never forget, her name was Elaine, and she'd walk over to my desk without socks on, and I thought, what am I doing here?
This is Boeing, ma'am.
This is not appropriate. Anyway, I did it, and I knew it wasn't where I was meant to be, and I kept thinking back to the people that really, got me through that year, and, Tim was his name. His name was Tim. That was the first love of my life. And some of his nurses were amazing. I will never forget one of the nurses he had. Her name was Paula. And whether she was on his floor or not, she would come visit him at night and sneak him movies that he thought he would like to watch. And she just made the journey brighter. And there was a nurse I'll also never forget because she was awful. There are some bad nurses. And if I saw her today, I'd probably knock her out or trip her.
Or at least walk up to her with your socks off and just try to throw her off a little bit.
And I just felt like I needed to go do that for people. I needed to go help them through something like that. And so I worked to do an accelerated nursing program. I went to St. Louis U. They had a 1-year program where you could go, if you had a bachelor's, you could go back and get a bachelor's of nursing degree. And I did it, and I knew my purpose was to be at Siteman. And my brother at the time, he was an accountant, and he happened to be doing the audit with Ernst & Young for our books, and so he had a connection to the floor. And so he got me in touch with the nurse manager, and I went and met her, and she's like, when can you start?
Wow.
And it was so therapeutic for me. That first year on the floor was just a great year of healing for me. I took care of so many amazing people, but the craziest thing is I had a 25-year-old, so almost the same age as Tim, and his name was Tim.
Oh, my gosh.
And he had lymphoma.
Oh, gosh.
And there were so many things in his case that were similar and so many that were different. But his parents were just shocked, and they just couldn't believe their son was going through it. And so just to be there and help their family and help him, I just knew it was where I was supposed to be.
Yeah, to be able to tell somebody, I literally know what you're going through, and to do for them what someone else had done for you. I mean, first of all, that should be a movie. That story, it's incredible.
And that you acted on it, that you acted on that thought. I mean, many people will have that thought and then let that go and not actually pursue it, but you just said, and probably in honor of his life too, just to honor him and help other people.
I mean, that's incredibly fateful. I think it perfectly embodies that, we're talking about how important nurses are and how valuable the work they do is. And when you're describing how you remember that one nurse, the way that a nurse can brighten the journey, I think is the way you put it, is incredible. They can help you forget for a few minutes that you are going through hell, because that little touch that they can have, it's like you're drowning and they throw you a life preserver or something like that. It's why I always say that it truly takes a special person to do that kind of job. It is not something where you can fake it till you make it. You can smell the bad ones a mile away, and you can just tell, you shouldn't be doing this. Mm-hmm. But the ones that get into it for the right reason, it's because they could not be doing anything else. So, that's just an incredible, incredible story.
Basically, Patrick and I could never do it. It's also, I need a co-host, so. So, Julie, what about you? What got you into
Which, by the way, I think you could do it. Well, I will say I really did not know what I wanted to do all through, high school, which most teenagers don't. And then I'll kind of sum it up. Just good friends of mine were in an accident my senior year. And it was somebody who I dated for 4 years as well, and became a quadriplegic. And so I lived in a hospital for about 18 months. And then I still did not know I wanted to be a nurse. I actually really was mad at the hospital system and didn't think that's what I wanted to do. And I had this little old lady nurse come up to me when we were discharged from the hospital and handed me a pen light and told me that I one day was going to be the boss and one day be a nurse. And I don't know, it just got me thinking, because I was kind of taking some college credit courses and not really knowing what I wanted to do.
She just popped out of nowhere and gave you a pen light and said you're the boss?
No, she actually, it was really funny because the hospital that we were in, she wore these white skirts, like the old school nursing, I'll say.
Okay.
And I kept telling her, how are we supposed to take him home? I don't even know what to do. And, we were in there for 18 months and she's like, you know what to do. I'm like, I have no idea what to do.
Yeah.
And so she kept telling me that she thought, this is your calling. This is what you're going to do. And I'm like, I think I was just mad.
Sure.
And she turned around and, handed me, I still have the pen light. She handed me a pen light. And then she put it in my pocket and she was like, you're the boss. This is what you're going to do. And She was actually, we were on the same floor with her for 9 months. So she watched my interaction every day. And
Yeah.
Very cool.
because they would always, I was just an 18-year-old. What do you want to be? I'm going to have no idea what I want to be when I'm older.
Yeah.
They're like, well, we know what you're
And
going to
these
be.
nurses are like, this is what you're going to do. Like, this is your calling.
Well, and look at you now. I mean, you literally still have that. It obviously resonated with you. So
I
very
love
cool.
it. It's literally, I always tell my patients, it is the best job in the entire world.
Are you going to do that to somebody one day? Are you going to give them the pen light and go, you're the boss now?
No, I'm the boss. No, I'm just kidding. Maybe one day.
Sure.
Pam, what about you?
So I, like everyone else, was 18, not really quite sure what I wanted to do. I had aunts who were nurses, and I really looked up to them. And my parents would call them when we were sick and things. And I thought, gosh, that would be really something nice to do. But like Patrick, I didn't think that I was smart enough to do that, to be a nurse. So I actually went and got my associate's degree in medical assisting. So graduated from that or finished that and started working in a doctor's office. And I thought, oh, this cannot be my life. So I decided to go to get a job in a hospital to see, how it would, what it would be like. And so then I went back to nursing school and got my degree. And it was hard to find a job. I've been a nurse for 38 years. So at the time when I was hired, there were not jobs. So I got a job on a spinal cord unit. So it was actually taking care of spinal cord and orthopedic patients. And so I had that job for about 20 years. I loved it. You got so connected to the patients. And as Julie was saying, patients were in the hospital at that time for, months at a time. And you got to know their family and everything about them. And it was just, I just loved it. And then I had the opportunity about 23 years ago to move to Siteman. And I thought, wow, what a huge way that I could assist people. So I manage a call center essentially for Siteman, where patients who are newly diagnosed themselves or for their family members or friends contact us and my team and just say, I was just diagnosed, or I think I have, what do I do? And they are just desperate, but we want to be there for them. Sometimes we have older patients who just don't have anybody to talk to, so they will just tell you their whole life story, really trying to just get into an oncologist. And so we assist them getting to, whatever specialist they need. But so many of the patients will call us back and say, oh my gosh, that experience was phenomenal. Thank you so much for getting me to that physician. You're my angel. Can I call you again? And they will continue to call us sometimes, for months.
I need Pam. Where's Pam?
It really is rewarding. I love my job, and I can't really see myself doing anything else but helping these patients. It's an honor to be a nurse and to be there to help these people.
It's clear that they remember you, which is like what you said, and that it's an honor. We put, a question out on Siteman social media just about, what is it that you remember the most about your nurse that made a difference in your life, or advice they gave you. And one person said, my nurse taught me how to remove a Nualesta injector by soaking the tape with alcohol. Siteman oncology nurses are the best. My hubby had leukemia in 2016 and they became family. There's not enough space here. Literally everything. Calming, encouraging, strong, courageous. And my sister called me this morning and said, when the nurse called me to tell me I had cancer, she told me to take a seat and get a pen and paper. And she told me to write everything down that she was saying and then made sure I repeated it back to her so I had all the information correct about my diagnosis. She calmed me and told me everything was going to be okay. And then she started crying, saying it. And my sister was diagnosed in 2019, and she's cancer-free. Our VP of operations, she has as a cancer survivor twice. She was in our first episode, and she remembered when she was going in to get her surgery. And the nurse looked at her and said, it's going to be okay. I was 25 years ago. And it just like...
She'd literally had the same procedure.
Yeah. And wow. I can still get tears in my eyes just thinking about the nurses that have helped my family when they've been in the hospital and sick, and my grandpa when he died, and my aunt when he died of cancer, and all these things. And I think you guys should walk around with capes, and you should be like Beyonce when you walk around. I love to use the Beyonce thing a lot because I was just at her concert. They have crowns.
Oh, God. You guys were caped up back in the day, though, weren't you? Wasn't that like old nurse garb? Didn't they rock capes?
I never got to wear that. We went straight to scrubs.
But that was a thing,
It was.
right?
We did wear dresses and hats.
Yeah.
And on your hat, you had a ribbon saying if you were like a graduate nurse or a full-fledged nurse. So, the patient knew if you were a student or their actual nurse for the day. So Yeah,
See,
capes were before my time, Patrick.
Sure,
there
but it
were
was a
capes.
thing,
yes.
though, right?
I feel
Okay.
like you're starting a thing. We have this morale team to like boost, how to support people. And maybe I should have like a cape and they should hand it out to like the next superhero of the week or
That's
something.
a great
That'd be
idea.
nice, yeah.
I might take that to
Right.
go.
Okay, yeah.
What is one piece of advice that you find yourself giving over and over again to your patients that you feel is something that resonates with them?
I think, we're talking to the patient when they're first diagnosed. And so just helping them that first step of their journey to get to where they need to be. And a lot of times we're just, one step at a time. They told you need to see an oncologist. We don't know if you need to see an oncologist. We need to have a tissue biopsy. Is it even cancer? So, just making sure that they're in the moment and getting what they need at that moment before they move on to the next phase. And by the time they hit the Shannon and Julie's areas, then Shannon and Julie and their staff are helping them through that phase. But, just the initial call, okay, let's slow down, take a step. Let's see where you really are or, where you need to be. Or if they're coming for a second opinion and they have no other options, maybe it's a clinical trial. Do you think I should come? Absolutely. Because even if they are terminal, all the quality of life or the extra days that they're with their grandchildren or with their loved ones is something to them. And that's something that we should be able to give them. And I think it's important that we help them through that.
And I guess for a piece of advice that was a pretty common thing that I share was ask the question. So like you might be sitting at home thinking that this symptom must be from, or this side effect must be from your treatment. It might be, but we might be able to fix it. Maybe we can't, but if you don't ask, like there are people that suffer for 2 weeks between treatments and then they come in and they're like, it was awful. I had this and this and this, but I tried this medicine and it didn't work. Call and ask. Somebody might be able to help you. I think that's one of the most important things. Don't suffer with that.
Yeah.
Yeah, you have enough going on without having to silently suffer with something just because you're afraid to ask.
Julie, what's your kind of go-to piece of advice that you'd give somebody going through it?
I think I always tell people, and I'm not sure if this is the right way to say it, but the old saying of this is, more of a marathon and not a race. We're not racing to get things done. I really, honestly, when my patients leave every day, I really do give them a hug or, pat them on the back or try to walk them out. And I'm like, just one day at a time. That is all you can do. My biggest thing when I'm talking to patients is what can you control? And so I go over like the 3 or 4 things that they can control because we can't control cancer and we can't control a diagnosis, but there's things that they can control. So I try to remind them of this is what you can control today and give ourselves small goals. What can I try to control tomorrow? And whether that be drinking 64 ounces of fluid or, trying to get in more calories or journaling, whatever they can control that day. And I really think that helps patients because when you get diagnosed, you feel so out of control. It's not, and you would know, Patrick, and, people who have been through these diagnoses, like you feel out of control. And so men and women, especially these married couples who've been together 40-something years, you have the husband who tries to tell the wife what to do. And I tell her to drink and I tell her to eat and I tell her to do this or vice versa. Mm-hmm. And I always include the spouse in my conversations. What can she control today and what can you control? That's all you can do.
Is there a story of a patient or a moment in your nursing career that just will forever stay in your heart and in your mind?
I have lots of them because, as I said earlier, there's some patients that you just will never, ever forget. I took care of a gentleman who fell off his roof trying to clean out his gutters or something, and he was in his late 60s, so it was very sad. Grandpa was now spinal cord quadriplegic. But just got to know his family and him, and he was in the hospital for months and months and finally went home, and his family took care of him. And he would reach out, and he probably lived another 7 or 8 years, totally wheelchair dependent, on a ventilator, everything. But I remember then reading my death notices, and his family reached out and, that he had passed away. And it just really touched me. This older gentleman, his name was Bill, and he's probably one that I will never, ever forget. And that was probably 35 years ago.
Is there anything else you wanted to share with our listeners just about what your hopes are that you might see in 10 years changing in cancer care?
I think cancer care has changed so much. It's changing every day. There's so many different treatments and so many things that are less invasive and more tolerated by patients. And sometimes, when patients call, they'll say, I don't want radiation. My grandma had burns. You're like, it has changed. We have so much more technology. So many, patients don't have to sit in the treatment room. They can go home with a pump. You can have a normal life. And so I think although it can be a terrible diagnosis and something terrible to hear, but we're here to help you through that and to make sure that you are comfortable in receiving the best care that you can at Siteman. And don't hesitate to call or reach out to anyone because we want to help you. That's what we're here for.
Shannon?
I would just say, make sure that you feel comfortable and confident in your relationship with your whole team. The nurses are a big part of your team, but make sure that your doctor answers your questions. And if you feel like there's a chance there might be something else out there for you, explore it. It's your life. I mean, if you want to hear it from another expert somewhere else in the country, go get another opinion. You only get one shot at it. Your first shot's your best shot when you're dealing with this. Just trust your instincts, and make sure you're where you're supposed to be. I can't say that enough because, we didn't start there. We started at a local place. I didn't know to ask the question, should we go somewhere else? When we got to Siteman, we got, great care there too, but it was too late to have gotten in a clinical trial. We didn't know that was an option up front. So just make sure you feel comfortable and confident in the relationships with your whole care team.
And one thing to add on to that I've learned is to not beat yourself up about what you could have done.
That's true. I could relive that too many times, and it does not help.
Yeah.
We got to move forward.
Mm-hmm.
Yeah, move forward and make the best decisions and reach out to whoever you need to. As Shannon said, go cross country if that's what makes you feel better. We have surgeons who patients have been told they're inoperable, and the patients will call, can I get a second opinion? What do you think? And our surgeons might look at the films and think, I'm not really sure, but they'll bring the patient in and explain. Yes, we'll try this, or you're really not operable, but we have this clinical trial. We can maybe assist you with this for a better quality of life. So just always take those chances, and it's okay to get a second opinion. Your doctor might be upset with you, but really, it's your life.
They say they won't, but I knew they do. I knew they do.
I actually don't believe that the good doctors do. I think
the insecure ones.
I think the ones that feel like they're giving you the best, they want you to get that confirmation.
Yeah.
And if somebody else is out there,
I'm sorry I jumped on that,
No,
Pam, but I had to.
I totally agree with Shannon. I always tell the patient, if they have offered you the very best and the most latest treatment that is possible, then they have no fear of you going someplace else.
Sure.
But there might be more stuff at another hospital that they don't have access to.
Yeah.
Right. So,
and a lot of our doctors have some connections, They're not going to probably offer it unless you're asking for it, but if they don't know it, they'll try to help you figure out where that person is.
Right. Or they might not have the surgeon might not have the equipment. But maybe you could be done someplace else. And I know, our surgeons will send people to other places in the country for clinical trials or for things. If they think that there's a better chance, they will reach out and send the patient away if necessary. We won't hold on to them.
What's the goal?
Right.
Right. I mean, you as a nurse and a physician, you should be working for the patient.
Right.
So they should be your number one.
Julie, what about you?
I think a piece of advice that I would like to tell patients and family is that cancer doesn't have to be a death sentence. And I think a lot of people, right when you hear that diagnosis, I think right away, I can say that in a sense because I've had cancer removed from myself and things that I've gone through when I was pregnant. And I have a whole different backstory there too. But I know skin anxiety and I know, that feeling in a sense to some degree. I never compare myself to my patients ever. But right away, you hear death sentence. As soon as you hear something and you hear this awful diagnosis or even a diagnosis that could be treatable, all you hear is death. And I really would like patients to understand, it's not a death sentence. You have a support team. And honestly, there's a lot of anxiety and things like that follow with this. And I feel like mental health during this needs to be important. I feel like just relying on your team. You have your coordinator, your nurse, your doctor, but you also need a counselor. You need mental health. You need support. It all should be one big team together because how can you possibly go into a treatment every day thinking you're going to die, dealing with anxiety, getting this toxin, they say, inside of you, and then go home and be normal, quote unquote normal. So I feel like just mental health is such a big thing that we should advocate for our patients better.
Mm-hmm.
So I feel like that's not always.
Don't side-eye me.
Well, it's hard. You don't always want to admit that you have anxiety or depression or fear.
Yeah.
But that is what every single patient has walking in there. Even if you look like you have it all together and you come in with your cooler of snacks, your food, your coloring books, your music, you're going to sleep. Every single person who sits in that chair has anxiety.
It's trauma.
It
is
is
trauma to be told you have cancer.
Yes. And it's PTSD every time they have to come back to get a scan 3 months later, a year later, 2 years later. It is PTSD no matter what. We're looking at you. No.
Right. You're always wondering when the other shoe's going to drop.
Right. Yeah, absolutely.
You'll always fear that. And, and there's not a magic pill that makes that go away.
Are you sure?
I don't think so. But when we get together and figure this out, but there isn't. And so I think it's just, figuring out what works for you, whether it's exercise, journaling, talking to a counselor, talking to someone else who's been in your shoes. Mm-hmm. I think that's like your only way to kind of have some sanity with it. And
sure.
I feel like everything when patients start is medicine. And it's like, okay, mental health.
Yes.
This is what we need to talk about for these patients. And I feel like when you're like on the treatment side, we get to play all of those roles. So I'm going to be your counselor, your mom, your sister. I get to do all of that.
You kind of buried that you had a scan and you had scan anxiety. Did you have a diagnosis of something?
So when I was pregnant with my daughter, I had melanoma removed that was a stage 2. And then they had done scans on me and had what they thought were spots in my liver and lung. And I was misdiagnosed for a month with possible sarcoma, and then they found out it was melanoma. So nothing like being an oncology nurse and for an entire month having your scan results sent to different states to get looked at and tumor boards. And
while pregnant.
I just had delivered.
Doesn't matter. The hormones are going crazy.
I think I will jump in and say what really made a difference in my anxiety then, and I will never say the doctor's name, it has nothing to do with our company, but the nurse and the doctor were so negative. And I was so fearful because of the words that were coming out of their mouth. And I'm like, oh my gosh, I have to get to Barnes. I have to get to, where I know. And I don't know, I was just fearful. Like everything was, well, the percent of this, and there's no treatments for this if it were to that, and the likelihood, and it was terrible. So I now have learned too, watch what you say. Think before you speak. I actually make those signs. I have one in our lab. I have them on my children's door. But, think before you speak, because like, oh my gosh, that changed my life.
Was it at Siteman, or did you go to Siteman from this?
I actually, because my dermatologist was just through a different hospital, and I ended up going through a different hospital, and they're like, oh, it's a simple surgery. We're going to remove this. And then all broke loose of, just that anxiety with it. So it really was how people talk to me. For the first time, and a lot of people don't really know this, but I would sit in the nursery and rock my daughter and think about, what kind of videos am I going to make her? Because back then, 9 years ago, there wasn't immunotherapy out yet to treat this kind of diagnosis.
Yeah.
I knew that. Thankfully, it didn't spread in my lymph nodes. Thankfully, my scans were okay. And, don't ever Google, things like that.
God, don't do it.
I think just
it's
like
impossible.
how we talk to people.
Yeah, telling people not to Google is hilarious. They're going to Google.
I Google.
I mean, I Google because
too.
I know how to read stuff. I can see my chart, know exactly what it is, understand what it is. I knew exactly what my BIRAD 4B meant.
Yeah.
And I knew my percentages, and I knew that there was weird lines around it, and I knew that I had a 42% breast cancer risk. I was like, first of all, I'm an oncologist.
Yeah, they can smell it on you too when you go in there. They're like,
I'm like, I know what 4AB is.
Googling.
It's 10 to 50%. I know exactly what. My sister's was 0, and she had breast cancer. So what's the deal? Just...
Yeah,
so
nurses, go ahead.
So probably when I talked to you, Laura, which I didn't even know you at the time, but I know you did call through my patient care coordination center. So probably when I talked to you, I was probably trying to talk you off the ledge. And then I would have made a call to the breast surgery and say, okay, this girl's sister had, blah, mom, your next appointment's 3 weeks out, but, can anybody get her in within 2 weeks?
Googling.
Whatever.
Yeah,
she knows what a BIRAD is. She's dangerous.
Yes. And then we came to start working on the podcast, and Laura said, I spoke to you.
That's right. That's right.
I did? Mm-hmm. Yeah, so you never know. People that
you
talk to on the phone and things like that, eventually, it all
But
comes
she knows
full circle.
she spoke to you. And
but now she
it meant
remembers.
something to her, and you talked her off that ledge. And
Exactly. It's all full circle. And what you guys do every day is life-changing, not in just the medicine that you're helping administer in the treatment. It's the compassion and the empathy and the relationships that you build. And just to hear you talk about relationships you built 25, 30 years ago to this day just shows that you were fully and 100% built and designed for this job.
And being married to a nurse, it's I know firsthand how special you three are, and how much heart you have to do what you do. And I truly appreciate each of you for what you do and for coming on the show today.
Thanks.
Now just make a Beyonce reference and
I'm not
we'll
going
wrap
to.
this thing up.
I'm not going. I'm going to make an Adele reference because I went to her concert on Saturday in Vegas. You guys are the Adeles of. I mean, she's won a lot of Grammys. That's what you guys are. You
That's
guys are
on
the
my bucket
Adeles
list.
of
I want your
nursing
ticket schedule.
oncology. Okay.
Totally
I want to
amazing.
see Adele.
It was amazing.
too.
Well,
Adele
I'm going
and
to.
I think the three of us need to go to
Within 2
Adele
days.
together.
We should have someone
Anyone
sponsor
listening to this
that.
podcast, if you would like to sponsor these lovely ladies to go to Adele, it is until November 4th in Las Vegas. Just write into the show and we will help get them there.
Bagels and Adele tickets.
We'll
they-
buy you bagels.
That's right. That's right.
That would be so nice.
Okay. All right. So if anyone's listening, she's there till November 4th.
That's
Okay.
awesome.
Thank you, ladies, for being here. You're amazing for what you do. And I feel like I do nothing now.
Thank you for doing these podcasts.
Oh my gosh, you're welcome. This is awesome.
Thank you. We appreciate you having us, and it's been wonderful.
Thanks for listening to This is Cancer, brought to you in partnership with Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis, national leaders in cancer.
For more information on Siteman Cancer Center, go to siteman.wustl.edu and be sure to leave us a review and like and subscribe wherever you listen to podcasts.